Another drawing in the performance and accountability framework, which would come as no surprise to those who are in the performance measurement area, is a schematic about how we think about organizations and how we think about services, and therefore how we create indicators to understand their contributions to health and experiences and sustainability, experiences of patients with care in a sustainable health system. Is boxes on the left, you have a program or service objectives for our organization. That service is really in the green box in terms of wanting to monitor and understand inputs, processes, and outputs, and how those outputs in fact relate to the outcomes of the population in the context of external influences. So this is a conceptual framework that lays the foundation for the indicators. Across that framework, actually, let me go back a bit. And across that framework, you see areas in scope for efficiency, areas in which you measure different types of effectiveness, as well as the influence of equity. So we have another schematic, again, from that framework document that says, okay, the summation of that really is then a focus on looking at effectiveness, efficiency, and equity. How do we measure that across issues such as access, appropriateness, quality, etc.? And how do we measure and attribute those things to outcomes? So another conceptual framework in the context of the performance and accountability framework. So instead of listing a whole bunch of 17 little dot points, we put examples here across that framework of indicators now that are in the performance and accountability framework, which will lay the future in terms of reporting expectations, nationally consistent, locally relevant information at the level of hospitals across the nation. So I'll just leave that up there for a minute. All available on our website.